With recent measles cases on the rise in Southern California, a lot of folks wanting to vaccinate but having big concerns. Should you vaccinate your children? Many doctors say you're running a huge risk if you don't. Here to shed more light on the topic, Dr. Susan Heifetz with Tri-City Medical. Good morning, Dr. Heifetz.
Good morning.
So talk to us a little bit about the statistics, the recent statistics here in Southern California and abroad.
Sure. The recent outbreak that we've been experiencing here in California has involved so far 68 cases of measles, 48 of which have been epidemiologically linked to Disneyland and California Adventure Park, and the remaining 20 are the epidemiologic link is not clear at this time, but possibly related to those cases that have occurred from Disneyland exposures in December and possibly also in January. There are also another 10 cases of measles that many of which have also been linked to Disneyland, who are in 7 other states, and also 1 case in Mexico, and the numbers are increasing. So this is an extremely important concern for this area, especially since although vaccination records for most of these cases have not been identified, 39 have been reviewed, and of those 32 were unvaccinated or under-vaccinated children.
Then we can see how easily then this can spread throughout the population, and not just within our own state here, but across the country. Talk to us a little bit about parents who want to vaccinate their child, but they're on the fence because they're thinking, and they've heard cases, you know, of friends or in the media, that this could be linked, vaccinating for any serious illness could be linked to autism or other serious problems.
So the scientific community has debunked the belief that there is any causality between MMR vaccine and autism. There was a study done by a researcher in the late 1990s, which was later found to have been done under unethical means, and the researcher later had his license revoked, and the Lancet was the article that retracted that study years later when it was found to be flawed and dishonest. So, and subsequent studies done by the Institute of Medicine in 2004, I believe, were done statistical large epidemiologic surveys that have shown no association between the MMR vaccine and autism. So there really is no reason not to vaccinate your children, and every reason to do so, because 2 doses of the MMR vaccine, which is the measles, mumps, rubella vaccine, that are typically given at age 12 months and then again between the ages of 4 and 6. 2 doses of that vaccine is 99% effective in preventing measles infection, and measles is highly contagious.
And the risk, I would imagine, the risk of what your child would go through and even possible death if they were to contract measles is probably far greater than getting some sort of other illness from a vaccination.
Absolutely. The measles is a very serious health risk for children. Those at greatest risk for complication are those under age 5 or over age 20. There are some common complications, ear infections and diarrhea, but more serious complications can include pneumonia, swelling of the brain or encephalitis, and in 1 to 2 cases out of 1,000 infected children, death can occur.
Okay. Well, unfortunately, we're out of time. There's so much more we could talk about with this topic, but you really have answered some very important questions that I know is on the forefront of a lot of people's minds, and I'd love to have you back again to talk about this further.
Thank you.
All right. Thank you so much, Dr. Heifetz.
Okay.